Minnesota prides itself as being one of the healthiest states in the nation. One of the measures of health that is often used is the infant mortality rate, or the number of babies who die in the first year of life for every 1,000 births. The overall infant mortality rate in Minnesota has always been at or near the top among all states. However, if we look at Minnesota's infant mortality rate a bit more closely, it is evident that this lofty status is not enjoyed by all. The overall rate of infant deaths masks the significant disparities by race and ethnicity. For example, while the overall Minnesota infant mortality rate in 2009 was 4.6 deaths per 1,000 live births, the infant mortality rate for African Americans was almost double that, at 8.5. And that disparity has persisted over many years. Why does that disparity exist, and why has it persisted, are just a couple of the questions we'll be asking on today's episode of A Public Health Journal. Please stay tuned.
Welcome to A Public Health Journal, a program that explores public health issues facing our society today and tomorrow. The host of the show is Dr. Ed Ellinger, Commissioner of Health for the state of Minnesota. A Public Health Journal is sponsored by the Minnesota Department of Health and the Hennepin County Human Services and Public Health Department, all working together towards the goal of healthy people living in healthy communities.
Welcome to A Public Health Journal. Today we're going to look at the issue of infant mortality in Minnesota, particularly infant deaths among African Americans, where disparities have persisted for decades. Joining me in this discussion of this major public health problem are Babette Jamison, African and African American Health Coordinator in the Office of Minority and Multicultural Health at the Minnesota Department of Health, and Clarence Jones, Community Outreach Director for the Southside Community Health Center. Welcome to our program, both of you.
Thank you.
And infant mortality is an issue that I've been addressing on this program for over many, many years, and it always is a concern, and it hasn't really gotten better over the many years that we've been talking about it. And Babette, I wanted to ask you, why is infant mortality such an important issue for us to look at?
Well, I think one of the reasons, and particularly as I have been working with a variety of different community groups, is the fact that it's something that people don't want to talk about. It's I think because the loss of a child is something that's it's frightening. It's something that's so unexpected. It's a joy that's lost to a family. But in the same vein, I mean, it is a very important issue, and it's something that communities, and that's all communities, need to be more informed of in terms of prevention, preconception care, early education. I think there's more information, education that needs to be provided throughout our communities.
You mentioned a little bit about why people don't want to talk about it, because it is a tough question when you leave it, but as a community as a whole, really affects, and we're going to be talking a little bit about it, affects really the African American community and other minority communities, in a disproportionate share. Is the community also sort of afraid to talk about it? Not just the individuals who suffer that death, but the community as a whole?
Well, yeah, because it's an uncomfortable topic.
Mm-hmm.
And I would say, because you don't know a lot of people who have lost a child, but the few that you do know, unless you've experienced that loss, I don't think it's easy to kind of really put yourself in that person's shoes. And that's in terms of not just the mother, but also the father, the grandparents, whether or not it was a first-time birth, mm-hmm. Or whether or not a woman has lost a child, several children. It's something that is just really hard to talk about, because it's hard to understand why it happens.
Okay. Well, I want to put this in perspective, and I want to give us some numbers. And I've got a graph here that shows the infant mortality rate in Minnesota. And it's something that I want to talk to us about, because we're going to be talking about the disparities. And the chart will show the fact that the non-Hispanic white, or the white population in Minnesota, we've done very well compared to the country as a whole. But African Americans and blacks and African Americans, the rates are much higher. Clarence, tell us a little bit about these numbers.
Well, I think one of the other questions, one of the other answers to your question too about why is it important, is that infant mortality is an indicator of the health of a nation or the health of a community, and when you look at our community, you see that the disparities is 2 and 3 times higher than other people. It says that there is a problem and an issue. And even here, as you take a look at the United States and you take a look at Minnesota, you see that Minnesota has a lower infant mortality rate overall, but we still have some huge gaps between communities of color and the white population.
All right. So now these are data from the Kids Count in 2008. But as I've been in healthcare for over 40 years, and the disparities have been there at least when I started. How long have these disparities been part of our health system?
Well, you know, it's interesting. I had a friend from Wisconsin that actually went to the Library of Congress, the Congressional Library, and he took a look at this. Way back in the 1850s, they were having issues with health disparities too. And the community got together and they started working on what could they do in order to decrease it. And the community got together and came up with some best practices and started to see a decrease in infant mortality. And so somehow we kind of lost that community collectiveness about looking at this as an issue. And now we're trying to once again regroup and to bring it back to the community to say, look, this is an issue. It has been an ongoing issue. How are we going to address this as we move into the 21st century?
Now, are these disparities a unique American problem, or are they international? I mean, what are the disparities in European countries, for example, where we always get compared? Our infant mortality rate is higher overall than European countries by sometimes 2 or 3 times. But do the disparities also exist in other countries?
I think when we take a look at some of the infant mortality indicators in other countries, we are twice as high as some of the European countries, and in some cases even higher. And so it's important for us to understand that there are some issues that we could be addressing. It's not just that it's people, but it's also environmental issues. There are individual behavioral issues. There are social issues that we need to address in order to really look at this issue and really begin to decrease the disparities between groups of people.
Mm-hmm. And then I know, Babette, you're the African and African American coordinator, and so we have a lot of Africans, who have moved to this country. What is their infant mortality rate compared to the African Americans, the people who have been here for a while? Is there differences in the rates of those two groups?
Yes, and right now, from what we see, that there is a big difference. I mean, African American, our rate is still higher than the native African population. We have seen some studies where we see that's slightly begin to change, but right now, and I think some of that may be due to the African population being able to maintain many of their cultural birthing traditions, that their rate has been able to be lower than African Americans.
I think that's kind of an interesting piece, because I think as groups come to this country and they become more Americanized, they seem to lose some of those natural safety features, and they start to become more like us, and that's a problem. So there's got to be something that we need to do here in this country and in our communities in order to be able to address some of these issues.
What do you think some of those issues are that cause people who come from other countries who have a lower infant mortality rate, have their rate starts to come up the longer they're in the United States? What are some of those issues?
I think they want to be like us. I mean, I think there's something wonderful about being American. I'm going to say it like that. But there's also some habits that we have that really hurt us. I always tell people when I go out, I'm supposed to be talking about health and wellness. And I mean, you look at me, you can tell I like hamburgers, And so there's a struggle in terms of trying to do what is best for us and to do what becomes, kind of the social norms. And I think we have to really present information to people to say, these are some issues that, these are how issues will impact you. These are the consequences of your behavior. This is how it impacts your children. I don't think that we've done that messaging very well.
Mm-hmm. Okay. Well, I want to talk a little bit more specifically about some of the causes of infant deaths and the causes of the disparities and what's to be done about it. But first, we need to take a little break.
Okay.
We'll be back right after this message.
African American and Native American infant death is twice and often 3 times the rate of other ethnic groups across socioeconomic levels. But all some researchers can say is, we don't know, we don't know, we don't know. Even though death with dignity has become a popular trademark phrase among many healthcare providers, crib death with dignity is not for us.
Welcome back. We're talking about infant mortality, particularly African American infant mortality in Minnesota, with Babette Jamison from the Office of Minority and Multicultural Health at the Minnesota Department of Health and Clarence Jones from the Southside Community Health Center. As I look at the data, it looks like the leading causes of infant deaths are congenital anomalies is number one, SIDS, sudden infant death syndrome, is number two, and preterm births or low birth weight babies. That's overall. Are those still the three leading causes for African Americans in Minnesota?
I think that yes, they are. And I think there's some other environmental things that we do, or behavioral things that we're impacted more by, and those are things like poverty, education. I think stress is a big factor for infant mortality. It's important to look at racism, economics. I mean, all those kinds of things are factors and it's been reported, researched, evaluated. I mean, all those kinds of things really impact the infant mortality rates in communities, but especially in communities of color.
All right. Well, you point out a fact that, when we look at the leading causes of death overall, it's cancer, heart disease, and stroke in Minnesota. But really, if you look behind that, it's tobacco use, alcohol use, obesity, drugs. So that what's on the birth or on the death certificate is different than the real cause. So what you're pointing out. So what are the real causes? What are the reasons why we have the disparities in this country and particularly in this state?
Well, I think there's a social justice issue here. I mean, when we start talking about access to jobs, I always talk about stress. Stress is not necessarily one of the things that we talk about a lot with people, but stress can kill. Drug use. We talk about as you said, alcohol, tobacco. I mean, behaviors. One of our favorite places, McDonald's. I mean, it's all these kinds of things are working against us as it relates to the health of ourselves also, but the health of our children.
Yeah, and I think also, too, particularly related to the health of ourselves is the overall access to medical care. And that's in terms of how soon and how often a woman may access services once she finds out that she's pregnant, as well as the type and level of service she receives once she does even find a medical home.
Yeah, we know that our medical care system does not treat every population the same, and then we also have the social and economic environment that also does not treat all people the same. Now, and I know that this has become an increasingly important issue because our population is changing, the demographics are changing. We have a lot more people of color in the state, the numbers are rising, over half of our births are to people of color. So we're going to have to really address this issue if we're going to really have a healthy state. So, Babette, what are some of the things that are happening at the Minnesota Department of Health and the Office of Minority and Multicultural Health in particular to address this disparities in infant mortality rate? Okay.
Well, one thing that's going on, and actually this began probably back in 2010, is that the Stair-Step Foundation conducted an environmental analysis of infant mortality in the African American community. And what that ended up being was an assessment of the community's perception of infant mortality, the causes, as well as knowledge of how to address the issue. And from that environmental scan, Minnesota Department of Health, the Office of Minority and Multicultural Health, as well as the Center for Data Statistics, partnered with a group that we call Community Voices and Solutions. And this particular group is a partnership between the Department of Health and several representatives from health and human services organizations that offer programs and services that address infant mortality. So over the course of the last year, this group was able to take a closer look and begin to prioritize areas that they feel will support improving birth outcomes, and that would be taking a closer look at evidence-based and community-based practices, available community resources and how to build on community resources, community outreach, better communication and education, as well as taking a closer look at the life course of a woman from the time that she actually enters the world and throughout and when she becomes a mother.
Well, let's talk through some of those things. What are some of the evidence-based practices that came out of that discussion from the Community Voices and Solutions document? Clarence, what are some of the evidence-based things that we know work?
Well, I think one of the things that we know is safe sleep. We have not really talked much about the issue of how does a baby sleep? Does it sleep on its front or its back? You know what I mean? We talked about the issue of just other kinds of crises that we should be looking at around this particular issue.
And are there cultural differences that how people get put to bed is varies from culture to culture? Are these some of the cultural issues that we also have to deal with?
I think we do. I did a focus group with both American Indian and African American fathers around the issue of sleeping, and it was very interesting how they are impacted and how they influenced around this issue. And so there are some cultural differences, and I believe that people are willing to take and do best practices if they're given it in an appropriate manner, and also to show that it's not against their culture to make those things happen.
Yeah, well, let's talk about some of the community resources was one. I suspect that what you did as you surveyed the number of agencies that were working on it. Are there adequate resources in our community to address this problem?
Well, we found that there are a lot of resources in our community. The one issue that the group is focusing on is whether or not if there's enough culturally appropriate or culturally sensitive resources available for the African American community. In terms of when we looked at culturally sensitive practices, we looked at doula services and how effective they are, as well as community health workers being able to work directly in the homes or in the field of high-risk families, as well as taking a closer look at home visiting programs and how case managers can better serve women and families, and particularly in terms of improving education.
Yeah, and I want to talk a little bit about some of the outreach and education, but we need to take another little break.
Okay.
We'll be back right after this message.
A full life, measured in seats, starts with the right ones early on. Car crashes are the #1 killer of children 1 through 13. Learn how to prevent deaths and injuries by using the right car seat for your child's age and size.
Welcome back. We're talking about African American infant mortality in Minnesota with Clarence Jones from Southside Community Health Center and Babette Jamison from the Office of Minority and Multicultural Health at the Minnesota Department of Health. You had mentioned from the Community Voices and Solutions document, you had evidence-based practices and community resources. You also had a couple of other things that I really want to talk about in this last segment, is that the communication and outreach and education. I particularly wanted the education piece, both to the women who get pregnant or are planning to get pregnant, and the men who are also part of their lives. Clarence, what are some of the issues that we need to educate folks about, that they need to become more aware about on both of those genders?
Well, one of the things, I do a lot of work with fathers, and one of the things I want men to know is that there is a preparation that you need to have yourself, before you talk about having children. I mean, you need to know your family's history. You need to know your general health. You need to talk about, what are some of the environmental things that you might be doing that might affect the health of the baby. And so for me, the educational piece comes in is engaging fathers in this conversation, or engaging men in this conversation, but also giving them information so that they can share that with their partners. And so that's really a lot of the focus that I'm looking at right now.
And then how about the education and outreach to women? I mean, there are lots of issues. There are behavioral issues. One, make sure, teen pregnancy is an issue. Tobacco use, alcohol use affect babies. Access to care. How do you get at those issues with the African American community? Many of which, are not as educated as we would like them to be, are economically not where we would like them to be, and in a society that doesn't always support their needs. How do you do that kind of outreach?
Well, and I think one thing that we talked about earlier, taking a closer look at those three service delivery methods, the doulas, the community health workers, as well as the home visiting programs. The one thing that's been very effective with this Community Voices group is that we've brought together individuals who are experts, and in terms of being able to connect folks who need services with the appropriate types of services. And we've also been fortunate enough to begin to learn about more services and groups that are available. Like, for instance, one in particular is the Minnesota Black Nurses Association, and they work a lot with Southside and really going out in a mobile unit, providing information, providing education. I mean, it's going through the churches, it's going through community-based organizations, community centers. Wherever we feel, sometimes it's even being able to go to a barbershop or a beauty shop, but wherever we feel that the population is and can be educated in a way where it's not something that's just so heavy, but it's something that's really common sense way of understanding how you can improve your health, how you can improve the health of your children in moving forward.
I think it's important, and I agree with Babette. I think it's important when we help people, when we have people self-identify that they're really interested in this area, to provide them with the kind of support and networking that they need in order to do a better job. Because there are a lot of people out here that are actually really doing some good work around this issue. And we come together collectively in order to make sure that they have the kind of support that they need.
Now, I know, Clarence, one of the important things is to get communities engaged in the issue, and that's why we have the community voices and solutions. And we focus on the women and the families, but what is the outreach and the education to policymakers? What do we at the state health department, what do we need to do? What does the governor need to do? What do city councils need to do? What does the state legislature need to do? What are the voices saying, up as opposed to down?
I think that's an excellent question, and it's one of those questions where we have to do a better job at making sure that the politicians are educated about the issues. I mean, they know the numbers, but they have to see the people. They have to understand that this is affecting them. It's affecting some of the decisions that they'll have to make in the future. It's not just not about money, but it's also about individuals. And so I think from what you're asking me, I think that we have to do a much better job in the community to make others aware that can actually help change the system of how important this issue is to us. And unless we make it important to us, they won't make it important to themselves.
Okay, well, that's part of what this program is about, to get those voices out there. One last thing I want to talk about, Babette, you had talked about the life course, the mother's life course, with, from the time she was born until the time she becomes a grandma. Tell us a little bit about the importance of this life course perspective on infant mortality.
When I think of the life course, I think of oftentimes we don't consider the entire life experience of an individual, from the environment in which they've been raised, as well as their educational background, and as well as any particular experience that might affect their physical or mental well-being. And so as the Community Voices group looked at the life course, I think it's a matter of really honing on those things that are most important in terms of when you're working towards providing better education and better care for women and their families. The one thing for me, for instance, my mother had 5 miscarriages. And the one thing about it is that no one took in consideration her life stressors, the work that she had to do to make certain that she maintained her family. I was actually the only child she was able to birth. And even to this day, I think it was more a matter of, the strongest survives, as opposed to that there were some things that occurred in her life that may have affected her ability to be able to bring those children to term.
So how do you use the life course kind of an approach at the Southside Community Clinic and your work, with these community voices?
Well, we make sure that people understand that our decisions, our choices, they have a consequence, to our lives. And so we want to make sure that people understand that throughout their life that the decisions that they make around their health, around their children's health, will have a long-lasting term. And so we just try to incorporate that and make people educated, talk about what type of resources do you need at various points in your life. We want them to fully understand that a decision is just not an arbitrary thing that is just siloed. Whatever the decisions that you make about drugs, about alcohol, about those things have a lasting impact not only on yourself but also on your children.
All right. Well, thank you both for being on the show. This is an important topic. We just touched the surface of this, and we need to have much more conversation, but I'm glad you've got the community voices engaged, the Office of Minority and Multicultural Health engaged. We're looking at this life course perspective, which means it's not just a one-time thing. It really is the community. It is the entire multi-generational issue and a community issue that we all have to deal with. Thank you for the information you shared with us today.
Thank you, Ed.
And I'll be back with a closing comment right after this message.
Lead paint poisoning affects 1 million children today. If you're pregnant or have young children and your home was built before 1978, you could be at risk. Learn how to protect your family. To find your home's danger zones, the health effects, or just to find help, log on to leadfreekids.org.
The infant mortality rate has traditionally been used as a measure of the quality of health care in a state or country. And over the last 40 years, in comparison to other countries, the ranking of the United States infant mortality rate has gotten progressively worse. 40 countries now have better infant mortality rates than the United States. Equally disturbing is the fact that Minnesota's ranking for infant deaths is also declining. According to Kids Count, a national report on children, Minnesota is now ranked number 20 on infant mortality. Traditionally, we've looked to our medical care system to turn this problem around. And the medical care system has responded by, among other things, increasing access to insurance and prenatal care, by building state-of-the-art newborn intensive care units, and by training perinatal medical specialists. However, the persistent disparities in rates point out the fact that infant mortality is not a medical problem. It is a social problem, an economic problem, a community problem with a medical component. Yes, we need to continue to expand access to health insurance and medical care and prenatal services, but we need to do much more. We need to focus on the real issues that lead to infant deaths: poverty, lack of education, racism, and segregation, among other things. Issues that are with us because of social and economic policies that have benefited some, often at the expense of others. That means we can't wait for our healthcare system to resolve this perplexing problem. All of us need to be part of the solution. That's all for today. Thanks for watching. I hope you can join us again next time on A Public Health Journal.